I would like to talk with you today about the possibility of the complication from a colonoscopy that might lead to a death. The death from colonoscopy are of two kinds: an immediate with perforation, peritonitis, feces go to the abdominal area, they remove the colon, there is antibiotic resistant bacteria and the patient die. Usually they do not report these cases of death due to a colonoscopy. They usually classified it as acute peritonitis and inflammation of the colon. Then we come to the slow death, where there is a diverticulitis or diverticulosis with a long run refers to diverticulitis, and this is a very serious disease, and those patients that have this condition can tell you how much miserable they are and how many hours they spend sitting on the toilet with bleeding and antibiotics and so many visits to the hospitals and hospitalizations, and finally they die. The death from this complication is also reported from the doctors who did the colonoscopy as severe intestinal infection or diverticulitis, and they never mention the colonoscopy as the primary cause of this condition. So the possibility of death after colonoscopy, according to the gastroenterology doctors, is between 1 to 2%. And I doubt too much this number, and if I take it as a face value, and with the recommendation of every man and woman over the age of 50 and sometimes 40 will go to colonoscopy, then we can say that hundreds of thousands of people suffer and die from complication of colonoscopy. I would like also to stress that the death certificate did not mention the colonoscopy as the cause of death. They mention any name of any complication without any relation to colonoscopy. Those people that have complication of colonoscopy, we do not hear about them because they go to the hospital and they classify them with different tags, with different names. Diverticulitis, they never mention the colonoscopy as the primary cause of the disease and the death. Also, there is a condition, I don't know if many of you are aware of it, it's called the primary dysfunctional outlet. This condition where the colonoscopy causes severe nerve damage to the colon ending in conjunction with the rectum and the anal opening, where the nerves of the anal opening disconnect with the colon and the evacuation is not go in synchronicity. That is to say, you have spasms of the colon to evacuate, but your anal nerves and the anal opening do not open for the passage of the feces because of the nerve damage. This condition is very, very severe and very painful, and one of the conditions that colonoscopy have created in our elderly people. So death by colonoscopy is the name of this video, in spite of the fact that many scientific medical organization and the FDA recognized the DNA test as screening and more suitable for screening of colorectal cancer than colonoscopy, but $7,000 per colonoscopy will make the saliva of these doctors coming on profusely to fearmonger you of polyps that is usually benign, and the chance to reverse to malignancy is very slim. So my advice to you, do not give your ass to those suckers. They are more dangerous than the terrorists that you ever heard about them. Because the terrorists, you guard against them, you know. They want to harm you, so you stay away from them. But those GI doctors earning money essentially from a screening colonoscopy is the hidden terrorists. They kill you, and they big mouth few cases that go through colonoscopy without complication. So believe me, if you wanna prove what I am saying, go to the file of Dr. Sabhas Banerjee in Stanford and ask his patients, see where they are. I am sure you'll find many of them in their graves by now. So this is an advice from an old man to every old woman and man: do not go to colonoscopy unless you are at high risk. Go for lab test. If you are positive, go for colonoscopy, or you will be sorry, as I am now. Thank you for listening, and I will keep in touch with you, because I want to prevent that with every legal method I could get hand on it. This is Dr. Siam. Have a good day.